I'm Kerry Fink with Helping Seniors of Brevard. Welcome to Helping Seniors Update. We're halfway through the week already, and here we are. It is Wednesday. It's May the 13th, and it's been radio day already, Dr. Sheldon, and we have the privilege of having you on WEJF Radio, which is the home for Helping Seniors Radio. Every Wednesday, 12 noon, join Joe Steckler and the entire team for great Helping Senior information. 90.3 FM. You can also listen live online at WEJF.net. That's WEJF.net. And it was a great show. And the good thing is that we always put up these radio shows for podcasts later, so you can access them on demand. And good information in our topic today, and I think you're going to be a guest next week with us as well, but we were really talking about dentistry after the coronavirus. And I know when you and I did a Helping Seniors update a few weeks back, Dr. Sheldon, we were sort of at the beginning of all the lockdown, stay at home, and now you're actually opening back up. And we were talking on the radio show a little bit about the article that you have in this month's Senior Scene magazine in the Helping Seniors newsletter, Dentistry After Coronavirus. So with that as an opening, how is dentistry after coronavirus?
We're wearing a lot more clothes, let me tell you, Kerry. You know, I think dentistry after coronavirus is going to be exactly the same as dentistry before coronavirus. The dentistry is going to be the same. How we work with each other and how we protect each other is going to be different because, there's still that unknown out there. And so while we have always been on top of infection control in the dental office, we're doing a little bit more. We have to do a little bit more now in order to be able to protect ourselves. Now, there's going to be more data that's going to come out over the next few years to know how good the protection is, but some of the things that we're doing right now to mitigate any aerosol is a big deal. Mm-hmm. Water spraying in the mouth and then coming out of the mouth.
Sure.
And, I'm concerned about my staff because my staff is breathing that air in 8 or 9 hours a day. And so if I'm concerned about my staff is going to do better. My patient's going to do better too.
Right.
But some of the measures that we've taken in order to be able to correct this are neat. They're unique. Mm-hmm. And may very well, the early clinical finding is it's making a difference to the staff, and the patients just love the additional care that's being taken. Right. So, a vacuum cleaner over the mouth, something vacuums aerosols out, that's pretty neat. So it isn't just wearing garb or protecting ourselves from the stuff that's coming in. It's preventing that stuff from ever getting close to our mask to begin with. And that's that I think is going to be a big deal. Yeah, we should keep our hand away from our nose. And so there I am scratching my nose in front of you. What can I do? It itches.
Well, you've always been way ahead of the curve on technology. I remember early on you were explaining you were one of the first dental offices along the Space Coast that introduced the CT scan technology so that you could really do that kind of work with precision. And I'm trying to remember the name of the periscope or something where you're actually able to go down and look.
Yeah, we're only one of very few offices in the entire United States that has it.
And you've always been advanced on kind of the cutting edge. And so I would expect nothing less as it comes to safely welcoming patients back.
It was so nice because, of course, I send emails to all my patients. I use Constant Contact, which I think is great. And we take pictures of everybody, and maybe you received it. And so you take pictures of what's going on. And the comments that came back from patients were, I always expected Dr. Sheldon to do something like that. That's nice.
That's great. That's great. So I know the last time we did Helping Seniors Update, you were open, but it was only for emergencies. And you actually said you were still getting quite busy just because of people having toothaches and issues like that. But now you actually are able to schedule patients again and really kind of get back to I guess I would call it mouth health.
It is, yeah. And our patients coming in, new patients coming in, and they're just coming in droves. It's very easy to schedule them. I had some doubts, but it is very easy to schedule them, and the phone is ringing off the hook. So I think that's a sign that people are ready to get back to normal. They're ready to get back into their routine. And if calling the dental office is a routine that they want to get back into, that's great.
That's good. And so when people do want to call, in fact, we had appointments. My wife and I had appointments scheduled with you. I think before this lockdown, and so we've got to get back into. But I was going to ask you, if people do want to call and get the process started, who do they call? What's the best number to reach you?
Best number is 321-259-8000, 321-259-8000. And I got to tell you, Kerry, you know, for anybody who listens here, they get the same thing that our referred patients get, and that is you come in for $50 to charity, and you get the X-rays, and you get the CT scan, the full examination, the whole 2-hour deal. But what happened over the coronavirus season, and this is the first time I'm announcing it, you've got a scoop. we went over $200,000.
Wow! Wow!
Yeah.
Wow.
So, yeah, something good. Something good. Get away from his nose. My goodness, it enters so. You know, coronavirus season is one thing. Allergy season is something else. I can't escape these allergies.
It's always something. But it's good to know that you guys are open and ready to serve, and so people should not be afraid of making a trip to the dentist.
I don't think so. I think, you know, I think it really depends upon where you are and where your mindset is. You know, Brevard County is a great place to be because the incidence of the virus was low. That's good. But yeah, I mean, if you're on immunosuppressants and you're sick, you know, I would wait a little bit longer unless you have a dental emergency. And by the way, if you have chronic disease in your mouth and you're letting that go, well, yeah, you do need to come in because we've got to keep that under control. Use some judgment, but understand we're using a lot of judgment too. Taking forehead temperatures and doing medical histories and doing all the things that we do, doing social distancing. So we now have a sit in your car reception room. We've got an outside reception room, and we've got an inside reception room. So people are split up. We're still making a lot of efforts to make sure that.
We talked about that a little bit on the radio, that I love the resiliency and the brilliancy of the American spirit of just like, whatever you throw at us, we're going to find a way to do it the right way. And so thank you again for number one, always being supportive of the work of Joe and the entire team of Helping Seniors. We have found this to be a very important time for Helping Seniors because Kim Bernard, our education specialist, even though we're not taking walk-in appointments still because our offices are in the Senior Resource Center, which is co-located, was on Beachside. And as you know, the governor has not lifted restrictions, and probably shouldn't, it would seem, for those kind of facilities for a little bit of time. But rest assured, the Helping Seniors helpline is open. Kim is staying quite busy taking calls at 321-473-7770. That number again, 321-473-7770. And Dr. Sheldon, before, I want to thank you for your time today, both on the radio and on today's Helping Seniors update. But also, just before we close out, I want to remind people that the Helping Seniors car raffle is in full force and effect. We are still moving 100% forward. As you know, the governor hasn't lifted the restrictions on large gatherings, and certainly the grand prize drawing for that winner getting to choose one of those beautiful 2020 cars in the Helping Seniors car raffle from the AJ Hires team at Boniface Hires. There's a Mazda, Miata convertible, a Chevrolet Camaro, a Dodge Challenger, and even a Kia Sportage, and the winner gets to choose which one of those they want. And it was such a fun party the past couple of years, and we're looking forward to it again. And I know Joe Steckler and Mark Pylock, the president of the American Muscle Car Museum, are looking forward to being able to announce the drawing date basically as soon as the governor lifts those precautions. So we're not sure if that's going, our expectation would be that's going to happen sometime as we get into June or July, and we'll keep everybody updated at least every 10 days on what we know about that. But you can still get your tickets at helpingsseniorscarraffle.com, and that is a great way to support the work of Helping Seniors. So thank you, Dr. Sheldon, for joining today. And then we will keep looking forward on these Helping Seniors updates. You can get them at helpingseniorsupdates.com. A lot of good material that we'll put Dr. Sheldon's phone number and the information about, if you're a new patient to Dr. Sheldon, you'd be doing two things. You'd be doing yourself a favor, but you'd actually be helping seniors if you go to if you attend and you visit and you're part of that charitable giving program that Dr. Sheldon. And congratulations, that is a tremendous milestone, I guess, in how you've really helped the community and giving back. And we thank you for all you do.
That's neat. Yes, of course, write a check for $50 or more to Helping Seniors of Brevard County, and the examination, all the extras are yours.
That's great. Well, hope you have a great week. Thank you again. And thank you, viewer, for tuning in for Helping Seniors Update. We'll see you on Friday.